We've had practitioners of decades of work in their clinic who have taken this training and have been astounded with the new levels of assessment and treatment that became available to them.
I've been doing emergency medicine for 40 years. I've been doing acupuncture for probably 20, 25 years, and I took my first auricular acupuncture course about 6 years ago. I'll give you a little example as to what happened. One day this guy comes in for back pain. He limps into the office. He sort of waddles into the office. He's late. I have to get a history. I have to sort of do an examination on him. So I said, I'm not going to be able to treat you today because you were late. I said, but okay, I'll just put one needle in your ear. I put one needle. I just used what I learned from the very first level 1. 15 minutes later, I say to him, so how are you now? He says, what do you mean? I said, well, did that needle make any difference? So he says, well, let's find out. So he stands up, he jumps up and down, he twists this way and that way, he takes the pen off my desk, throws it on the floor, bends over, picks it up, and he says, yeah, well, I guess it worked, didn't it? So now, obviously, right, we always talk about our successes, we don't talk about our failures, but that was sort of a major success. It's a complete paradigm shift from Western medicine. Emergency medicine gives me the foundation in medicine, in Western medicine, but there are other approaches to healing people, to helping people. And now here I come. I was treated by Dr. Frank Bahr today, sort of the master of the German auricular acupuncture. 3 needles and incredible success with my disc extrusion, massive disc extrusion onto L4. I've been crippled for the last 4 weeks, and now I'm moving with no pain today. After, 20 minutes after his treatment, 10 minutes after his treatment.
And some of our students have even switched and have completely shifted their practices into fully being German auricular medicine practices. I'm Muriel Agnes. I'm the founder of the Canadian Institute of Auricular Medicine. Actually, we coined that term, German auricular medicine, because in Germany it's just auricular medicine, which is the system that was developed and is taught by Dr. Frank Bahr at the academy he founded. Until Dr. Beate Strittmatter published this book in English, German auricular medicine was only available to German-speaking medical doctors. We've been working with Dr. Beate Strittmatter since 2003 and have developed and evolved a curriculum of training in auricular medicine that is practical and gives you the tools previously unavailable to English-speaking health practitioners of any practice except medicine, emphasizing practical, hands-on, experiential engagement with the material, which is necessary for you to become an auricular therapist. And now, here is our newest version, which you're going to be participating in, and we're very excited about it. This new fully online version was developed by the director of Canadian Institute of Auricular Medicine, Dave Mabey, who is also your instructor, and Devon Hoffman, our director of development. Their creative work is bringing this new online version to you. We still value your practical engagement in this material. In fact, it's the only way for you to become an auricular therapist. And we've built in methods, your self-study, your self-assessment, live discussions with Dave Mabey, to help you feel personally connected to your learning journey. There are benefits to having a fully online course. We've had students from around the world bemoan the fact that they could not get the full level 1 training. Now you can, wherever you live. And also you can do it at your own pace. This material is available to you for you to repeat and go over as many times as you want to in a way that it wasn't for previous students. So welcome to you from around the world, dentists, body acupuncturists, physiotherapists, medical doctors, psychiatrists. Previous students have been from all kinds of health modalities and have found that German auricular medicine is adaptable and can be brought into whatever type of practice you have at whatever level you feel comfortable with. If you do decide to treat an auricular point, you can use laser, needles, seeds, electrotherapy. There are different forms of treatment. You can choose what it is that works for you in your clinic. But some examples. If you're a manual therapist, you might want to identify specifically the spinal level and the structure that is involved in a patient's pain. Body acupuncturists have found it very powerful to add associated auricular points to the treatment that they do on the body.
I also get a vas reaction. The vas just opened up a degree of security, of knowingness that you are accurate. You found the point. It was so precise.
As a dentist, you can find exactly what tooth or what structure is burdening the system and are hidden.
There's a certain number of dentists using acupuncture and getting some results. But with the auricular acupuncture, they're getting the root cause, and that is what all doctors are interested in. This nails it.
Perhaps your patient has psychological issues. Regardless of the type of clinician you are, it's wonderful to know the Valium point, the depression point, the aggression or anger point, the pain memory point that can bring out deeply buried trauma, something hidden that the patient isn't even aware of, that the ear is showing you. Some of you may work in a hospital setting where you can only treat a few points. Well, this training is going to help you be more precise and more accurate so that when you're treating that point, it's much more effective. In the Canadian Institute of Auricular Medicine, we don't promote protocols. We don't presume to know what the most effective points are to treat this patient today. We uncover it. With this training, you become a detective with a toolkit, and you're going to be able to use the amazing ear to uncover the most efficient healing pathway for your patient. It's very exciting work because of that discovery that you're going to be able to do. Enjoy your training.